هلا عندنا practical lab 1. أولا هذه بالصورة you can see the green color in frontal bone اللي هو يكون البون باللون الأزرق، وباللون الأخضر المؤشر عليه بالبرتقالي parietal bone, and you can see the two parietal bone articulate with each other in the midline by sagittal suture. The upper border of coronal bone articulate with the anterior border of the two parietal bone to form the coronal suture. Now, this slide showing the pterion with the four bone of articulation in this region. You have the yellow, the greater wing. You have the blue color, the frontal bone, the green color, the parietal, and this where the arrow, blue arrow, this part of the parietal is the anterior angle. And posteriorly we have the red color, the squamous bone. Posteriorly you can see the lambdoid bone between the posterior border of the two parietal bones and the upper border of the occipital bone. Again, here, if you look inferiorly about the middle, you can see the three suture, the lambdoid suture meeting the parieto-mastoid suture and occipito-mastoid suture. Again, inferiorly with the orange color arrows, you can see the zygomatic arch, which is formed by the zygomatic process of the temporal bone posteriorly and by the temporal process of zygomatic bone anteriorly. Now this slide again showing you the pterion. You can see the yellow، هذا اللي حكيته سابقا السكويموس، وعندنا zygomatic bone here with the purple color arrow, and you can see behind the squamous and below it يعني خلفه وتحته you have the mastoid bone which represent the mastoid process, and the blue color posteriorly which is indicated by the black arrow, this is the occipital bone. Here the body of maxilla indicated by the orange color arrow and its upper process which is indicated by the black arrow. This is the frontal process of maxilla, and inferiorly with purple color arrow you can see the inferior process which is the alveolar process, and with the red color arrow you can see the lateral process which is the zygomatic process of the maxilla. Again you can see the two nasal bone articulate with each other, their anterior border articulate with each other in the midline to form internasal suture. Superiorly the upper border of each articulate with the frontal bone. The posterior border of each bone articulate posteriorly with the frontal process of the maxilla, whereas the free border is free and form part of the anterior bony nasal aperture or opening. Here you can see in the middle, in the midline, you can see the groove for the superior sagittal sinus, and anterior to it we have the frontal crease from where the sagittal sinus begin, and the groove also, and you can see the pits on each side of the superior sagittal groove, and this is a granular foveal for the arachnoid granulation. The bone with the purple color arrow anteriorly, this is the frontal bone. وهذا اللي باللون القهوائي هو ال two parietal bone, and posteriorly the blue color the occipital bone. Now here the cranial fossa, anterior cranial fossa, you can see with the red color arrow the cribriform or horizontal plate of ethmoid, which permit for the passage of about 20 olfactory nerve. Again, you can see with the orange color arrow the orbital plate اللي هي باللون الأزرق, which is part of a frontal bone. It forms the most of the lateral part of the anterior cranial fossa, and it also forms a great part of the roof of the orbital cavity. Again, anteriorly you can see the frontal crest, and behind the horizontal plate, which is indicated by the black arrow, the جاجم سفينودال. وقلت لكم أنا ما أريد يعني هالاسم، أريد مجرد أنه اللي بين قوسين هو anterior part of body of sphenoid bone. Now laterally you can see with the purple color arrow the laser wing of sphenoid. قلنا the frontal bone is occupied by the anterior cranial fossa is occupied by the frontal bone, and you can see the various sulcus. This is stamped by various the sulci and gyri. Now the middle part of the middle cranial fossa is formed by body of sphenoid, and you can see anteriorly behind the jagmosphenoidal the transverse groove, which is called the sulcus chiasmaticus or chiasmal sulcus, and lead on each side into the orbital canal, which open into the orbital cavity. Now you can see the halo behind, or the Turkish saddle, and this is sella torsica, and the black arrow indicate the hypophyseal fossa, where the hypophysis cerebri or the pituitary gland lie in this. Posteriorly you can see the dorsum celli, and its supralateral angle are expanded to form the posterior glenoid processes. Now let's go. Even you can see the posterior border of the laser wing of sphenoid expand backward and medially to form the anterior glenoid process, which is indicated by the blue color arrow. هلا نجي على lateral part of the middle cranial fossa. Here you can see anteriorly with the blue color the greater wing of a sphenoid, posteriorly with the red color arrow the anterior surface of the pectoralis, and laterally wedge in between these two we have the squamous part of temporal bone. And don't forget that the middle cranial fossa is occupied by the temporal lobe of the cerebral hemisphere. Now here you can see the anteriorly on the left side, indicated by the purple color arrow, the superior orbital fissure، وقلنا هذا يمرق منه خلاله the third cranial nerve, which is oculomotor, the trochlear nerve, which is the fourth cranial nerve, the branches of ophthalmic nerve اللي هو البرانشز ذولا اللي هم frontal ونازوسيلري ولاcrimal. And then we have the abducent, the sixth cranial nerve. Also the superior ophthalmic vein pass through all of these. Now behind its medial part you can see which is indicated by the pink upper orange color arrow, you can see the foramen rotundum through which the maxillary nerve pass. Now look to the posterolateral to the rotundum. We have foramen oval, which is in an oval shape, and through it pass the mandibular nerve as well as the accessory meningeal artery. Posterolateral to it, a small circular foramen, the foramen spinosum, through which pass the middle meningeal artery. The three foramen rotundum, foramen oval, foramen spinosum, all of them, they pierce the greater wing of a sphenoid. Now behind the greater wing of a sphenoid, between it and the anterior surface of petrous, you can see an irregular gap اللي هو سميناه foramen lacerum، وقلنا هذا هو مو foramen الحقيقة. It is a gap which is closed by cartilage, and sometimes an imaginary vein perforate this cartilage and pass through it. Now here you can see the anterior surface of the petrous. You can see just behind and lateral to the apex there is a shallow depression, قلنا trigeminal impression، وهذا for trigeminal ganglia. وبعدين posterolateral to it, which is indicated by the orange color arrow, الاركويت eminence اللي تعملها قلنا semicircular canal. And you can see the grooves and lateral to the trigeminal impression. There are two grooves. The medial groove is for the greater petrosal nerve, and the lateral for the lesser petrosal nerve. Don't forget lateral، وهذا بعدين هم اكو صورة حشوفكم اياها بعدين. Now look here, the posterior cranial fossa, you can see it is formed mainly by the occipital bone, but only a small area anterolaterally formed by the posterior surface of petrous, and a small lateral area formed by the mastoid bone اللي هو باللون الأحمر indicated by the purple color arrow. You can see the foramen magnum here in the middle, and this foramen قلنا راح تقسم الoccipital bone into the following. You see, this is the anterior to it, the basilar part of occipital bone، وقلنا من يعني فوق إلى تحت هذه قدام الفوريمن ماجنم عندي دورسم سلي اللي باللون الأخضر، وتحته posterior part of the body of a sphenoid، وتحته اللي باللون البرتقالي هذا هو basilar part of occipital bone, and the three elements will form the clevus upon which the brainstem lie. طبعا posterior cranial fossa is occupied by the cerebral hemisphere, right and left cerebellar hemisphere. هلا on each side of the foramen magnum we have the lateral part, and behind it we have the squamous part, which is the largest part of the occipital bone, and as you see it is divided by the internal occipital crest into two fossa. The internal occipital crest begin from the posterior margin of foramen magnum and end in the internal occipital protuberance. هذا الكريست وهذا الانترنال occipital protuberance وهذا الكليفس. طبعا الكليفس من فوق من الأخضر إلى تحت. Now here you can see the internal acoustic meatus indicated by the black color arrow. هذه هي about the middle of the posterior surface of the petrous. وقلنا through it pass the 7 cranial nerve, nervous اللي هو facial nerve, nervous intermedius, و an artery اللي هو labyrinthine artery. Now behind and below it, between which is the jugular foramen, which lie between the petrous and the occipital bone. Through it we have the 9 cranial nerve, glossopharyngeal, the 10th cranial nerve, vagus, the 11th cranial nerve, the accessory, and the the internal jugular vein pass. Now, over the upper border of the petrous, you can see a groove. That groove is for superior petrosal sinus. وهذا superior petrosal groove. Now here you can see with the black arrow هذه هي jugular tubercle, which lie in front of the anterior condylar foramen أو hypoglossal canal. سميناها anterior condylar foramen لأن هذه هسه اللي نشوفها هذه upper opening, the lower opening lie in front of the occipital condyle. فلأنه صار قدام الoccipital condyle سميناها anterior condylar canal. سميناها hypoglossal canal because the hypoglossal nerve pass through it. Now look, خلينا نروح على الصورة اللي بعدها. Now look to the groove which start from internal occipital protuberance. هذا عندي 2 transverse groove. These are for the transverse sinuses. شوف اطلع على look to the right one, which is continuation of the superior sagittal sinus. واحنا قلنا اللي هو continuation of superior sinus, sagittal sinus is usually the right and sometimes the left. Whatever it is, this is the transverse sinus, who is continuation of superior sagittal sinus, the groove for it is wider. Now look to the groove, start the transverse, the groove which is a transverse one for transverse sinus, passing laterally and end at the base of the petrous. هلا نجي على المانdible. Here in the midline you can the symphysis menti, which indicate the fusion of the 2 mandible, right and left. Now inferiorly symphysis will split and enclose a triangular shape raised area اللي يسميناها mental protuberance. And on infralateral, at the infralateral angle of this protuberance, there is a bony يعني فد بوني. خلينا نشوف الصورة اللي بعدها. لا ما موجودة العفو. على كل اللي هي mental tubercle. At the infralateral angle we have a small tubercle سميناها mental tubercle. Now look to the oblique line which start anteriorly from this mental tubercle and pass upward and backward, where it becomes continuous with the anterior border of the ramus of mandible. Well, the oblique line is indicated by the blue color arrow. Now look to the mental foramen which is indicated by the green color arrow. هذه قلنا هي يعني اللي بالكتب مالتكم هي midway between the upper and lower border of the body and just below the second premolar tooth. بس احنا قلنا هذه مو يعني usual لأن أكو اختلافات فيها. Now the upper border of the body is called alveolar process of the mandible, which carry the upper lower dental arch. We have 16 socket for the lower teeth or mandibular teeth. Now look to the lower border of the body meet the posterior border of the ramus of mandible, and the point of meeting is called the angle of mandible اللي هي بالأحمر. Now ramus showing two processes. The upper border of ramus present two processes, anterior which is triangular in shape وهذه سميناها coronoid process, وposterior one is the condylar process. والcondylar process consists of a wide part اللي هو الhead upper part, و below it there is a constriction اللي هو neck of the mandible. Inner aspect of the mandible. Inner aspect of the mandible, you can see the mental spine على الsymphysis menti. عندنا on each side there are two, superior و inferior، أو نسميها هي upper mental و lower mental spine أو superior and inferior genial tubercles. قلنا سميت genial tubercle لأن للsuperior attach the genioglossus and to the inferior attach geniohyoid، فلهذا سموها genial tubercle. And according to their position حقنا superior و inferior. نفس الشيء للmental upper mental spine أو lower mental spine. Now you can see the mylohyoid line. The mylohyoid line حكينا start from just behind the third molar tooth, and then it runs downward and forward until it reaches the symphysis menti. It divides the inner aspect of the body into an upper and lower part. The upper part is in contact with the sublingual gland وسميناها sublingual fossa، والlower is submandibular fossa because it is in contact with the submandibular salivary gland. Now look to the inner surface of the ramus. Now you can see now here the rib. يعني هذا هو typical rib. You can see the head consists of two facets. The upper facet articulate with the vertebra above، بينما lower with the vertebra numerically the same number. After the head we have a constriction، هذا هو neck of mandible، and then after the neck on the outer surface we have the tubercle. حنجي لها بعدين. Now look to the internal surface اللي يعني مؤشر عليه. You can see there is just above the lower border parallel to the lower border a groove. هذا costal groove for the passage of vein. vein شنو؟ من الأعلى إلى الأسفل. vein, artery, nerve. intercostal vein, intercostal artery, intercostal nerve. According to their position vein سمينا حتى تذكرون. vein above بعدها تيجي الارتري، وbelow all the art vessels, we have the nerve, intercostal nerve. Now you can see also the external surface. Now look to the anterior end of each rib and طبعا عدا ال11 و12 and in costal cartilage. Now look to the tubercle, which is النيك قلنا حوالي طوله 2.5 سنتيمتر، والتيوبركل تبعد إذن عن الهيد بحوالي قلنا 2.5 سنتيمتر. The tubercle consists of two parts. Medial part هو articular carry facet for articulation with similar facet on the transverse process of the rib, numerically the same number. بعدين a lateral non-articular part which is used for ligamentum attachment. هذه هنا الفاسة اللي على الهيد واضحة، و don't forget they are separated by a ridge اللي هو crest. Now احنا قلنا كل الرب هي typical except the first, second and the last three، 10 و11 و12. هلا نجي على الفيرست. شو الفيرست؟ الفيرست هو أولا the most curved rib where it is short. You can see that the head carry only single facet. Then you have the طبعا احنا نسينا بالنسبة للأنجل على التيبيكال ريب. الأنجل قلنا هي the area of most convexity، يعني sharply bent. بالريب كل من تاخذ الريب اكو بي شارب رينج شارب كيرف. هذا الشارب كيرف هو او شارب بند هذه الشارب بند هي الانجل اوف ذا ريب، وقلنا هذه تبعد من تقريب 5.5 إلى 6.5 سنتيمتر عن التيوبركل. Here in the first rib the angle and the tubercle coincide، يعني اثنيناتهم ما مو قصة يعني انه شوية تبعد، لا they are on the same point. بعدين كل الأضلاع عندها outer surface و inner surface، بينما هذا ب upper surface و lower surface. على ال upper surface you can see two grooves، the anterior groove for subclavian vein and the posterior one for subclavian artery, and on the inner border of the first rib between the two grooves there is a tubercle نسميها scalene tubercle. ولا تنسون على ال posterior groove مو بس الارتري وإنما the lower also we have the lower trunk of the brachial plexus. Here you can see the anterior and posterior groove. قلنا الجروف الأمامي for subclavian vein والجروف الخلفي for subclavian artery and the lower trunk of brachial plexus. On the inner aspect of inner border you can see the scalene tubercle. هلا بقية الأضلاع 10 و11 و12 قلنا بها يعني only single facet. بالنسبة لل11 و12 هم أكثر الأضلاع ما بيهم لا نيك ولا tubercle. ال11 في الكوستال جروف very shallow، وبينما يعني والتيوبركل ماكو هنا باثنيناتهم. لكن بالنسبة لل12 كل شيء ما بيه، لا نيك لا تيوبركل لا كوستال جروف كل لا انجل كل شيء ما بيه. هلا نجي على هذه الانترفيرتبرال ديسك. حكينا الانترفيرتبرال ديسك as you see in the diagram هذا lie مثل السندويتش between the two surfaces of the vertebra, the inferior surface of the upper vertebra and the upper surface of lower vertebra. وقلنا ذولا two surfaces كل واحد is covered by hyaline cartilage, و between them sandwich الانترvertebral disc اللي هو fibrocartilage، والجوينت اللي راح يصير هو secondary cartilaginous joint. Here you can see the transverse process بالأخضر indicated, and you can see the spinous process indicated by the red color arrow. Now look to the typical cervical vertebra. احنا قلنا كلها typical عدا الفيرست والسكند واللاست، يعني 4 هي typical و3 they are atypical. هلا نجي للtypical. شو المميزات اللي بيها؟ اولا البادي is small as you see in the diagram compared with the thoracic and lumbar. It is small and it is wide from side to side. بالنسبة إلى الvertebral foramen it is triangular in shape. بالنسبة للtransverse process present foramen اللي هي foramen transversum وtransversarium، واللي يمرق منها two vessels اللي هم vertebral artery والvertebral vein. بعدين you can see the spine is short and bifid. فبالنسبة إلى vertebral foramen large and triangular in shape، the spine short and bifid. عندنا بالنسبة للtransverse process قلنا present foramen، بالإضافة للtransverse process present two tubercle anterior and posterior tubercle. الانتيريور tubercle of the 6 is large قلنا نسميها carotid tubercle, and you can compress the artery when you have bleeding on that tubercle. هلا آخر شيء بالنسبة احنا إذا تذكرون حكينا بالنسبة إلى attachment of the pedicle to the body. البيديكل ما هي بمساحة البدي، وإنما it is small، فتترك notch above and notch below. النوتش above is shallow، بس النوتش below it is deep، وهذا يسموها intervertebral notch superior and inferior. بالنسبة للcervical التو notch lie are similar، يعني مو الفوق shallow والتحت deep، لا اثنيناتهم they are. ليش؟ لأن الاتاتشمنت للبدي بالنسبة للبيديكل هي يعني midway. هلا هذه all about the typical cervical vertebra. هلا نجي على الفيرست متكون من two lateral mass مثل ما تشوفون بالصورة، and they are connected by a short anterior arch and a long and more curved posterior arch. The anterior arch and posterior arch both present in the midline tubercle، اللي للanterior arch anterior tubercle والposterior arch posterior tubercle. Now the transverse process passes from the lateral mass, and you can see superior articular facet على الماس على lateral mass. بالنسبة للsuperior articular facet it is kidney shape تطابق للoccipital condyle، لأن الoccipital condyle اللي هو on the base of skull external surface it is kidney shape، فهذه نفس الشكل. بعدين you can see on the back or posterior surface of the anterior arch in the middle just behind the tubercle there is a facet، وهذه الفاسة اللي هي oval in shape، حتى هذه for articulation with the dens، لأن الدنس أيضا على the anterior surface of it, we have that oval facet for articulation with this facet. هلا بالنسبة إلى آخر شيء, just behind the lateral mass there is a groove for the passage of vertebral artery. يعني الvertebral artery هيطلع من الforamen transversarum وبعدين pass behind the occipital condyle and then pass over this groove behind the occipital condyle وبعدين turn upward حتى يدخل من الفورامن ماجنم إلى السكال. هلا نجي على بالنسبة إلى ال 7 cervical vertebra. The 7 cervical vertebra, as you see, the process is long one. يعني the spinous process أو the spine is long and not bifid. بعدين you can see posterior tubercle here, هذه مال transverse, وذيك anterior tubercle indicated anterior بالارو اللي هو green, والاورنج color arrow هذه posterior tubercle. And you can see the facet on its superior surface for articulation with the facet on the lower surface of the 6. بالنسبة إلى الفقرة الثانية اللي احنا ما شفناها هنا, واللي قلنا الفرق الوحيد من البدي there is a process pass upward, وهذه هي مثل التوث like process, وهذه يسميها dense أو odontoid process. Now look to the body of the typical thoracic vertebra. It is heart in shape. Now look to the vertebral foramen. It is rounded and small. Look to the spine. The spine projects upward, backward and downward. بعدين حكينا أنه بالنسبة إلى transverse process, as you see with the اللي مؤشر transverse process بالarrow اللي هو green in color, you can see just close to the tip we have facet for articulation with the articular facet اللي موجودة على the tubercle of the rib. Now look to the body. The body bear demi-facet near the upper border و lower أو inferior facet, demi-facet near the lower border. فعندي superior و inferior demi-facet, superior near the upper border inferior near the lower border, and they are on the side of the body close to the pedicle. Then you can see here the superior articular process with their facet, and you can see the transverse process with its facet near the tip. Also you can see with the green color arrow the spine or spinous process, which gonna project backward and downward. And you can see the inferior articular process with its facet. هلا الاتيبيكال هي قلنا الفيرست، وعندي الثلاثة الأخيرة 10 و11 و12، وقلنا sometime in 9 احنا ما ناخذ 9 ما علينا. هلا شو الفرق بالفيرست؟ الفيرست as you see there is complete facet for the first rib، هذه السوبيريور facet، مو demi facet، بس اللور it is demi facet for the upper facet اللي موجودة على الهيد of the second rib. هلا نجي على بالنسبة إلى 10 و11، عفوا 10 complete facet كل واحدة بيهم، هذه 9 اللي تشوفوها اللي فوق. هلا هذه 9 you can see sometime it fell. يعني أنا ما أريدها منكم، بس اللي أريد اللي تحت هاي you can see it. هذه هي 10 و you can see it has only single facet which is complete one for the 10th rib. بالنسبة إلى transverse process still there is a facet. هسه نجي على 11 و 12. 11 و 12 as you see in the diagram both of them they have complete facet for the 11 and 12 rib respectively, بس the transverse processes has no facet near the step. طيب شو فرق 11 على 12؟ as you see in the diagram the 12 الفاست اللي على البدي move to half of it أو even sometimes part of it على البيديكل. هلا نجي على شيء آخر هو السكرم. اللمبر فيرتبرا حكينا إذا تذكرون بالنسبة لللمبر فيرتبرا قلنا اللمبر فيرتبرا الأشياء المميزة اللي بيها هي البدي is large and kidney in shape، وقلنا هما أكبر الفقرات، وأكبر فقرة بالجسم هي الفيفث لمبر فيرتبرا. بعد من يبدي السكرم البدي يبدي become smaller. هلا نجي على الشيء الثاني اللي قلنا بالنسبة إلى الفيرتبرال foramen تكون triangular and large، بس لما احنا نقارن ويا الفيرست هي نفس التواصيل، بس الفيرست if we compare the foramen with the body it is large، بس هنا if you compare it with the body مو ذاك اللارج، يعني it is large. هلا بالنسبة إلى الشيء الآخر اللي هو بالنسبة إلى الترانسفيرس بروسيس قلنا بالنسبة للفيث it is cylindrical long شو اسمه. نجي على السباين ده it is أولا short flat و quadrangular و it is directed backward. هلا نجي على السكرم. السكرم متكون من fifth vertebra S1 S2 S3 S4 S5 وذولا they articulate with each other to form a triangular shape structure سميناه the sacrum. والسكرم has two surfaces اللي هو anterior وسميناه pelvic surface و posterior وسميناه gluteal surface. Since the anterior surface located in the pelvic cavity سميناه pelvic surface. The posterior surface قلنا it is lie within the gluteal region فسميناه gluteal surface. هلا الشيء الآخر بدنا نعرفه أنه الانterior surface is concave. بالنسبة للposterior surface it is convex. بالنسبة للفرق بالميل والفيميل هذا راح ناخذها باليوروجينيتال. الميل more curve يعني than in female، يعني الكونكافيتي أكثر. هلا نجي على بالنسبة للشيء الآخر اللي عندنا البيس اللي هو located superiorly والapex located inferiorly. والapex على تقريب البودي على الأسفل يعني lower surface of body عندنا facet for articulation with similar facet على upper surface of the first coccygeal vertebra. هلا نجي على upper surface أو you can see the upper surface of body of the first sacral vertebra. You can see the anterior border here protruded forward وهذا تعمل promontory ونسميها promontory of sacrum أو sacral promontory. والsacral promontory هو حدود بين pelvic cavity والabdominal cavity. يعني احنا ما عندنا separation بين مثل الثوركس بين البلفيك كافيتي والابدومينال. السيبريشن بين الابدومينال كافيتي والبلفيك كافيتي هو الدايفرام. هنا ما عندنا separation بس عندنا حدود. فأحد جزء من الحدود هو البرومنتري، هالبروز اللي بالupper border of the first sacral vertebra. Behind it there is the upper opening of the sacral foramen, sacral canal. هنا ما نسميها vertebral canal، sacral canal، ولا تنسون هذه بها الكودا equina والفيلم terminal. Posterolateral to the upper opening of sacral canal, we have the superior articular process, which articulate with the inferior articular process of L5. Lateral to the body, we have the ala. We have the ala of the sacrum. Now, lateral عندي يعني هذه بالميدل هو البادي indicate the articulation of body، وعندي اللي بالخطوط الحمراء هذه اللاين. These are the line of fusion of this body. On each side of it, of each line, there is foramen. هذه هي anterior sacral foramen for the passage of the anterior or ventral rami of sacral nerve. وهذه الفورامens communicate with the sacral canal. Now, lateral to this foramen هذه هو الترانسفيرسال التحام للترانسفيرسال process، the fusion of transversal processes، وهذا نسميه the lateral aspect of the sacrum. Posterior surface of gluteal surface. You can see in the middle we have the median sacral crest, which is formed by the fusion of the spine of these vertebrae. Now, laterally, you can see four on each side. There are four foramen. These are the posterior sacral foramen for the passage of the posterior or dorsal rami of sacral nerve, and these foramens similar to the anterior, they communicate with the sacral canal. Now, medial to these sacral foramen there is a crest قلنا نسميه medial sacral crest وأحيانا نسميه intermediate sacral crest، وهذا indicate the fusion of the articular processes. بعدين lateral to the foramen we have a crest which is lateral sacral crest, indicate the fusion of the transverse processes. Now between the middle and the medial, between the middle median sacral crest and the medial sacral crest هذا structure هو is formed by the fusion of the lamina, and we said the lamina of 4 and 5 sacral vertebrae are absent, leaving an N-shaped gap، وهذا هو sacral hiatus. هنا يعني الساكرال كانال مكشوفة، ماكو wall. Sometime a third sacral vertebra also الlamina is absent، بس اليوجوال هو 4 و5. هذه superior articular facet you can see of S1 above, posterolateral to the red arrow which is the upper opening of sacral canal. Inferiorly you can see on each side of the N-shaped sacral hiatus you can see the sacral cornea which articulate with similar cornea of the coccyx. هسه نيجي على هنا هذه العفو هذه ستيرنوكليدوماستويد، يعني ما أخذها لأنه كوبي بيست، فما صحوا أوكي. هلا هذه هي الستيرنوكليدوماستويد muscle. We can see its two head اللي هو sternal head وclavicular head، ولا تنسون التراينجل اللي بيناتهم، وقلنا this is clinically important because in this triangle or behind this triangle we have internal jugular vein passing downward. أيضا you can see the insertion of the sternocleidomastoid into the mastoid process. Here you can see the occipitofrontalis anteriorly indicated by the green color arrow. Anteriorly you have the frontal belly and posteriorly the occipital belly. Even you can see the temporalis, one of the muscle of mastication, which take origin from the temporal fossa. And the tendon pass behind the or deep to the zygomatic arch. Here you can see the posterior belly of digastric indicated by the black arrow, and above it you have the stylohyoid. Now here you can see the nasalis indicated by the blue color arrow. Well, the nasalis, لا تنسون قلنا two part, compressor areas و alar. Compressor و alar. Now you can see the procerus which pass يعني just above the root of nose، وعندكم هذه الأوربيكولاريس أوكيلي اللي بالجرين، هذه هو الأوربيتال بارت اللي هي قلنا الأوكيلار بارت، وهذه العفو البالببرال بارت اللي بالبيربل كلر. بالبيربل كلر هذه قلنا screw the eye gently as when we go to sleep، بينما ocular part اللي هي surround the margin أو surround the orbital opening without يعني تعمل complete ellipses around it without interruption. وهذه when it contract it will screw up the eye as when you exposed to sunlight or bright light. قلنا إذا اشتغلوا اثنينهم الأوربيتال والأوكيلار بارت اللي راح يصير الآي not close eyelid not close gently but forcibly, as when we hear the blue or when we sneeze or crying of child, etc. You can see inferiorly the orbicularis oris، ولا تنسون الأوربيكولاريس oris هي طبقتين، الطبقة الخارجية superficial part و deep part. The superficial part is formed by the all the يعني muscle above and all muscle below، يعني elevator والdepressor and retractor of the upper and lower lips respectively. الdeep part هي من الباكسينيتر. بالنسبة للsuperficial part قلنا bring the lips together and protrude them، بينما deep stratum أو layer bring the lips together but retract them. هلا هنا you can see the master one, the second superficial muscle of mastication. الsuperficial هي قلنا الtemporalis والmaster. لا تنسون التمبوراليس الانتيريور فايبر they are vertical, posterior fiber horizontal, والmiddle fiber they run obliquely. فالupper fiber يشتغل على closure of mouth، بينما posterior horizontal fiber يعمل على retract the mandible after protrusion، يعني يرجع المكانه. بالنسبة للأوموهايد you can see the superior and inferior belly of the omohyoid, and you can see the sternohyoid. Both the sternohyoid and omohyoid they are infrahyoid muscles, they are the superficial layer. A deep layer of infrahyoid قلنا sternothyroid thyrohyoid بالصورة اللي بعد. هذه you can see here inferiorly بالgreen color هذه sternohyoid, and above you have the thyrohyoid. هذول يشتغلون على اللارنكس، يطلعون اللارنكس بال first stage of swallowing، بعدين بال late stage of اللارنكس تنزل لتحت. Now here above with the blue color arrow you can see the هذه العفو had depressor labii inferioris, and you can see the depressor anguloris below it with purple color. Now you can see levator scapulae. الليفيتر سكابيلي ده تشوف اللي ده يمشي النيرف اللي عليها نازل، هذا هو accessory the spinal part of accessory nerve indicated هذه levator scapulae بالاورنج color arrow. فالspinal part of accessory هو يدليك على هاي العضلة، وهي تدليك على spinal part of accessory. هذه all about this diagram. Now this diagram you can see the zygomaticus minor and major. الماينر بالبلاك color arrow والblue color arrow you can see the major. وبعدين you can see the levator anguloris at the angle of the mouth بالضبط فوق الdepressor, above the depressor. Right, here the external oblique muscle you can see، وهذه هي الrectus abdominis بالgreen color arrow. لاحظ the direction of the fiber passing downward and forward. Now here you can see the three layer. أولا superficial هي external oblique with direction قلنا downward and upward downward forward. هنا internal oblique direction is upward backward. وبالنسبة للtransverse abdominis transversely. And you can see with the orange color arrow the aponeurosis of external oblique muscle. Now this is the posterior abdominal muscle. You can see above the quadratus lumborum. You can see on each side of the vertebral column at the vertebral gutter you have the psoas major muscle. We can see below the iliac crest. هذا يعني شوف فوق الأخضر، ده تشوف فوق الأخضر السهم الأخضر، هذا الأبيض اللون هذا هو الإلياك crest. Now this is the iliacus with the purple color arrow which take origin from the iliac fossa. واثنينهم هي والبسوس يعني الانsertion in the tendon of psoas, where they have the same action. هلا هون you can see the external intercostal muscle, and you can see it end at the costal cartilage، ما تكمل تحت الcostal cartilage، والarea is filled by anterior أو نسميه external intercostal membrane. سمينا anterior لأن اللي بالخلف من الأنجل إلى التوبركل هذه posterior و internal. external لأن هي العضلة external هي اللي تكملها. Now here you can see the superficial inguinal ring and you can see the inguinal ligament. وحكينا يمرق منها أولا الشيب مالها هو قلنا triangular in shape والبيس هو البيوبك كريست وقلنا هي صايرة فوق and lateral to pubic tubercle. هلا بالنسبة إلى الأشياء اللي تمرق منها هو السبرماتيك كورد بالميل وبالفيميل round ligament of female on both sex we have the ilioinguinal nerve. Now here you can see the various openings in the skull. You can see the foramen lacerum above indicated by the orange color arrow. You can see the red color arrow indicate the jugular foramen, and you can see below it we have the blue color arrow indicate the anterior condylar or hypoglossal canal upper opening, and you can see on its lateral side which start from base of petrous and end in jugular foramen هذا sigmoid sulcus for sigmoid sinus. هلا هذه الأوبتيك canal posterior opening of optic أو upper opening of optic canal نفس الشيء. We can see with the orange color arrow the foramen rotundum. You can see the oval indicated by the red color arrow. Okay, and you can see still the groove for sigmoid sinus. هلا نجي على هذه التوبركل indicated by the blue color arrow. هذه هي jugular tubercle which lie in the front of the anterior condylar foramen أو canal. You can see أيضا the indicated by the orange color arrow the shallow depression for trigeminal ganglia. Also you can see the arcuate. هذه ترى التأشيرة trigeminal ganglia, and you can see posterolateral to it اللي indicated by the red color arrow هذه الارcuate eminence, and you can see lateral to it البون formed by يعني هالجزء من البترس formed by tegment tympani which roof from behind forward the mastoid antrum, tympanic cavity أو middle ear, and auditory أو eustachian tube. هذه هي كل ما هنالك بهالصورة. هلا نجي على هنا. You can see the lateral part of the middle cranial fossa. You can see anteriorly the greater wing of the sphenoid, and posteriorly anterior surface of petrous, and laterally the squamous part of temporal bone. You can see also the clevus اللي هو المنزلق اللي عليه البرينستيم واللي يتكون من فوق لتحت من الدورسم سلي the posterior part of the of body of the sphenoid, ثم inferiorly basilar part of occipital bone. You can see also the anterior surface of the petrous which is indicated by the blue color arrow. هلا هون you can see with the red color arrow هذه هو horizontal plate of the frontal bone, and you can see the cresta galli in the midline اللي هي قلنا مثل شراع المركب triangular shape of upper projection project from the middle. لا تنسون قدامها between it and the frontal crest we have the foramen cecum, and on each side of it we have a slit for the passage of anterior ethmoidal nerve. You can see with the orange color arrow indicated هذه orbital plate of the frontal bone وقلنا تعمل roof of the orbital cavity وجزء كبير من lateral part of the anterior cranial fossa. You can see also the anterior glenoid process which is indicated by the purple color arrow. Will the red color indicate the horizontal plate of frontal bone of ethmoid. Now you can see here the frontal crease indicated by the orange color arrow and the laser wing, which is indicated by the purple color arrow. Now look to the posterior border of the laser wing, which project backward and medially to form the anterior glenoid process. Now here you can see the internal acoustic meatus اللي راح يمرق منها the facial nerve, nervus intermedius, vestibulocochlear nerve, also the labyrinthine artery. وهذه الforamen magnum indicated by the orange color arrow. وأيضا you have the inferior groove for inferior petrosal sinus اللي هو بين البترس وبين البيزلر بين الأوكسيبتال بون. هذا groove this junction، يعني هل fusion أو articulation is grooved by the groove for inferior petrosal sinus.